Hello future RNs, this is Sir Josh, and for this recorded lecture, ang tatalakayin naman po natin is all about your pleural effusion. Okay, so pag sinabi nating pleural effusion nurses, this is a condition wherein there is a collection of fluid in your pleural space. Okay, nurses, remember this one that normally, meron po tayong minimaintain na amount of fluid or that pleural fluid in your pleural space. Ilan dapat yun, sir? It should only be 5 to 15 ml. Ano siya usually yung primary, ano usually yung mismong function ng ating pleural fluid? That is to what? That serves as a lubricant. Okay, that will allow pleural spaces to move without friction. Yun po yung ginagawa ng ating tinatawag na pleural fluid wherein it should only be 5 to 15 ml normally. Okay? But in the case of your pleural effusion, nagkaroon pa ng abnormal accumulation of your pleural fluid, okay, or yung mismong fluid in our pleural space. And remember nurses, okay, any condition, okay, that interfere with the secretion or drainage of these fluids, that will eventually lead to your pleural effusion, making your PF as what? It is actually a rarely lang po siya na nagiging primary disease process. Kasi sabi natin, pag pleural effusion, if there are any conditions, okay, that could interfere with your secretion or drainage of these fluids, that will be, or that will lead eventually with your PF. Kasi yung PF natin, that is just a secondary to any other diseases. Okay, so let's proceed with your pathophysiology. Of course, sabi natin, since ang ating pleural effusion, it is only a secondary one to any other disease or any disease process, no? That's why, bago ka magkaroon ng pleural effusion, possible, meron kang underlying disease or conditions na hindi natitreat. Like for example, what are these disease or conditions natin? Number one, pag si patient meron siyang heart failure, sulat natin. Pag si patient meron po siyang heart failure, what else? Pag si patient meron siyang liver, or any kidney diseases. Okay, and of course, meron siyang mga respiratory diseases. Like for example, we have your pneumonia. What else? Meron siyang infection. Or possible, meron din siyang any malignancy. Wait lang, nurses. Okay, meron siyang malignancy. And aside from that one, meron siyang inflammation or inflammatory process sa kanyang respiratory system. Okay, that will lead to your tinatawag natin na pleural effusion. Okay, ngayon with these diseases or these underlying conditions that could actually disturb our normal fluid balance in our pleural space. And pag yan ang nangyari, pwede pong ma-alter yung ating forces controlling your fluid movement. So ano nga ba itong mga forces na to? Of course, number one, we have here yung tinatawag natin na hydrostatic pressure. Ang nangyayari, nurses, with the hydrostatic pressure for patients na merong pleural effusion is what? Nag-i-increase po ang kanyang hydrostatic pressure. Wherein, pag nag-increase po ang hydrostatic pressure ng isang patient due to your pleural effusion, it will going to push more. Itutulak po niya yung ating mga plasma fluid, okay, pushes more your plasma fluids into your pleural space. Yan po yung tinatawag natin na pag-increase ng ating hydrostatic pressure. Okay, how about with your oncotic pressure? Ano pong nangyayari sa oncotic pressure ng patients na mayroong pleural effusion? Nagdi-decrease po ang kanyang oncotic pressure. Remember yung oncotic pressure natin, basically it hugs your water. But with the case of your pleural effusion, nagkakaroon po ng less fluid reabsorption into your capillaries. Okay, nagkakaroon po ng less fluid reabsorption into your capillaries natin. Okay, next naman tayo, nurses, here with our permeability or your capillary permeability. Okay, in the case of your pleural effusion, ano nga ba ang nangyayari sa kanyang capillary permeability? Nag-i-increase po ang capillary permeability ng patients na merong pleural effusion, making it Okay, mas nagkakaroon ng leakage, no, ng ating mga proteins and even our cells into your pleural spaces. Okay, nagkakaroon ng leakage ng ating proteins and cells into your pleural space natin. Okay, because of the increase in your capillary permeability. What else? Ano pang nangyayari pag nagkakaroon ng alteration in your forces controlling your fluid movement? Pwedeng magkaroon ng obstruction of lymphatic drainage. Pag na-obstruct po yung ating lymphatic drainage, what will happen? Pwede pong ma-impair yung ability ng ating katawan to remove your fluids in your body. Okay, pag ito ang nangyari na alter natin ang ating mga forces, no, na siyang nagko-control sa mismong fluid movement inside our body, that will lead to the accumulation of your fluid into your pleural space. Okay, nakadepende na naman po kung anong klaseng fluid ang nag-accumulate in your pleural space. Okay, meron po tayong dalawa. We have your transudate and meron din tayong tinatawag na exudate. Si transudate nurses, remember, anong characteristic ng transudate natin? Usually, they are clear. Okay, they are clear and they are considered as low protein fluid. Okay, they are clear and they usually are low protein fluid. And aside from that one, pag titignan natin ang characteristic ng ating transudate fluid, of course, makikita natin doon wala pong any pleural membrane damage. Okay, wala pong any pleural membrane damage. Kanina natin pwedeng makita ang transudate fluid sa mga patient na mayroong pleural effusion. Usually, mga patients na mayroong, number 1, we have your heart failure. What else? Mga patient na mayroong nephrotic syndrome. Okay, what else? Mga patient na mayroong liver cirrhosis. Okay, usually sila po yung mga patients natin na mayroong transudate fluid in their pleural spaces. Okay, next naman tayo with the other one, we have yung tinatawag natin na exudate. Si exudate naman, kabaliktaran lang po siya ng ating transudate. Okay, they are considered as what? Protein-rich. Okay, protein-rich po sila, and pag titignan natin yung kanyang characteristics, they are usually cloudy. Okay, cloudy and purulent fluid. Okay, remember, pag cloudy or purulent fluid, that suggests what? Possible damage to your pleural membrane or meron tayong inflammatory process dyan. That's why yung merong exudate, okay, na nag-accumulate, exudate fluid na nag-accumulate sa ating pleural space, sila po yung mga patients na merong pneumonia. What else? Mga patient na merong malignancy. And lastly, mga patients na merong pulmonary tuberculosis. Okay, usually exudate po yung characteristic ng fluid na makikita sa kanilang pleural spaces. Okay, next naman tayo here is that pag nagkaroon ng accumulation or abnormal accumulation of your fluid in your pleural space, pwede pong what? Pwede pong ma-compress or ma-impaired ang ating lung function natin. Wherein, pag na-impaired po ang ating lung function, na-compress po natin ang ating lung, what will happen? Possible magkaroon ng mas maraming fluid build-up. Okay, magkakaroon ng fluid build-up, that will eventually lead to what? That will eventually lead to your compression of your lungs, wherein pag na-compress po yung lungs natin, what will happen with our lungs? Nagdi-decrease po yung kanyang expansion capacity. Nahihirapan na po siyang mag-expand. And kapag yan po ang nangyari, nag-decrease po ang expansion capacity ng ating lungs, that will eventually lead to what? That will eventually lead to your ventilation and your perfusion match na tinatawag natin. Ventilation and perfusion match. Okay, nagkakaroon ng ventilation and perfusion mismatch. Okay, perfusion mismatch. And pag nagkaroon ng mismatch, what will happen, nurses? That will impair or that will decrease your gas exchange. May impair po yung mismong gas exchange ng patient natin na merong pleural effusion. Okay, ulitin natin, nurses. Sabi natin kanina, in your pathophysiology, usually ang ating pleural effusion, hindi po siya primary disease. Ibig sabihin, meron pang mga other conditions, meron pang mga other diseases, okay, that causes you to develop your pleural effusion. Okay, as long na itong mga condition na to that will interfere with the secretion or even with the drainage of these fluids, that will lead with your pleural effusion. Okay, ano yung mga underlying conditions na yan? Number 1, we have your heart failure. What else? You have your liver or kidney diseases. Also, we have your pneumonia. And then lastly, we also have to your pneumonia, your infection, your malignancy, and of course, meron tayong inflammation. Okay? So with this, tawag dito with this condition, pwede po niyang ma-disturb yung ating yung ating normal fluid balance. Like for example, meron tayong iba't ibang forces here. We have your hydrostatic pressure, we have your oncotic pressure, we have your capillary permeability, as well as with the lymphatic drainage system natin. So ngayon, in the case of your pleural effusion, na-alter po natin tong forces that controls your fluid movement. What will happen with the hydrostatic pressure of our patient? Nag-i-increase po ang hydrostatic patient ng patient natin, wherein it will going to push more your mismong plasma fluid natin into your pleural spaces natin. How about with your oncotic pressure? What happens with your oncotic pressure? Pwedeng mag-decrease ang oncotic pressure ng patient na mayroong pleural effusion because there will be less fluid reabsorption into our capillaries. Okay, what else? We have also your capillary permeability. Pwedeng mag-increase ang capillary permeability ng patients na merong pleural effusion, wherein that will lead to the leakage of your proteins and your cells papunta sa ating pleural spaces. And then lastly, pwede pong ma-obstruct yung mismong lymphatic drainage ng system natin, wherein nagkakaroon pa ng impairment yung ating katawan para matanggal sana yung mga fluids outside from our body. Okay, and then of course, pag yun ang nangyari, na-alter po natin yung mismong forces that controls your fluid movement, that will lead to abnormal accumulation of your fluid in your pleural space natin. Ano yung mga characteristics or yung dalawang klase ng ating fluids that can be found in your pleural space in the patients na merong pleural effusion? We have two. We have your transudate, and then meron din tayong tinatawag na exudate. Pag sinabi nating transudate yan, okay, they are considered as clear, low protein fluid na that will suggest na wala pong any pleural membrane damages. Okay? How about with your exudate? Mga exudate naman, kabaliktaran ng ating transudate, they are protein rich. What else? Anong kanyang itsura? They are cloudy, and of course, meron po tayong tinatawag na purulent fluid. Okay, kanino po natin nakikita ang ating exudate? Sa mga patient na merong pneumonia, patient with malignancy, as well as with your TB. Okay, usually class, itong malignancy na to, okay, makikita natin si patient talagang meron siyang tinatawag na neoplastic tumor. Kanino usually associated tong malignancy na pwedeng mag-cause ng pleural effusion? Sa mga patient na merong bronchogenic carcinoma. Hindi ko kasi na-mention kanina. Mga patient that have, mga patient na merong bronchogenic carcinoma. Okay, how about with your transudate, sir? Kaninong patients naman makikita ang transudate fluid in their pleural spaces? Sa mga patient na merong heart failure, patients who have your nephrotic syndrome, as well as with your patients na merong liver cirrhosis. Okay, so after that one, pag na masyadong madami na yung mismong fluid that accumulates in your pleural spaces, that will lead to decompression and impairment of your lung function. Pwedeng mas mag-build up ng fluid dun sa ating lungs, okay, or even with your pleural space, that will lead to the decreased expansion capacity of your lungs. Pag nahihirapan na po siyang mag-expand, pwede pong magkaroon ng disturbances dun sa ating ventilation and our perfusion. Kaya nagkakaroon ng mismatch between these two. And that will eventually lead to your poor gas exchange. Or pwedeng magkaroon ng decrease or impairment dun sa gas exchange ng patients na merong pleural effusion. So what are the clinical manifestations na pwede nating ma-assess kay patient na merong pleural effusion? Number one, pwede siyang magkaroon ng dyspnea. Bakit siya nagkakaroon ng dyspnea? Of course, that is due to your lung compression. Okay, nagko-compress po kasi yung mismong lungs natin, that will eventually lead to your dyspnea. Okay, pwedeng magka-dyspnea si patient, difficulty in breathing. What else? Pwede siyang magkaroon ng pleuritic chest pain. Bakit po, sir? Remember, nurses, due to your pleural irritation, okay, mas nagkakaroon ng, mas nagde-develop si patient ng pleuritic chest pain. Okay, because of your pleural irritation na tinatawag natin. And usually, kailan mas nag-worsen yung ating pleuritic chest pain na yan? It usually worsens upon inspiration. Okay, or pag nag-i-inhale si patient, mas nagkakaroon siya ng pleuritic chest pain. Increases in your or worsens during your inspiration. Okay, what else? Si patient pwede siyang mag-manifest ng cough. Okay, bakit pwedeng magkaroon ng cough si patient? Of course, tawag dito, dahil nga nagkaroon tayo ng bronchial irritation, pwedeng mag-manifest si patient ng it's either a non-productive or dry cough. Okay? What else? Si patient pwede siyang magkaroon ng fever and chills due to your what? Due to your infection. Okay? Usually, it is being caused by your infection. And of course, pwede siyang magkaroon ng decreased breath sounds or dullness on percussion. Okay, that's why yung patient natin, makikita natin if you're going to auscultate, meron siyang absence or decrease with their breath sounds. Kasi nga sabi natin kanina, because of the too much accumulation of your fluid in your pleural space. Okay, what else? Of course, pwedeng magkaroon ng dullness on percussion. Okay, because of your fluid accumulation din. Okay, over the affected area, kung saan mang part ng lungs ang nagkaroon ng pleural effusion. Okay, so those are the clinical manifestations na makikita natin kay patient na merong pleural effusion. So what are the different diagnostic tests, okay, that will suggest or that will determine na meron talagang pleural effusion yung patient natin? Okay, number 1 here, we have your chest x-ray. Okay, what else? You have your chest CT scan and even with your thoracentesis. Wherein with this type of diagnostic procedures, we are going to confirm, okay, mako-confirm po natin ang ating tinatawag na presence of your fluid. Okay, we're going to confirm if there really is a presence of your fluid in your pleural space. And usually, makikita natin din ilang amount ng fluid, at least more than 250 ml. And of course, pag nagkaroon ng presence or accumulation of your fluid in your pleural space, pwedeng magkaroon ng what? Pwede siyang magkaroon ng semi-major pneumothorax, pwedeng magkaroon ng mediastinal shift. Okay, possible na magkaroon ng mediastinal shift yung patient natin away from the fluid. Okay, away from the fluid. Okay, what else? Ano pang ibang tawag dito, ano pang mga diagnostic procedures that will require, okay, that will determine if there is really an accumulation of your fluid sa mga patients na merong pleural effusion. We have yung tinatawag natin na pleural analyzation. Wherein with this one, okay, we're just going to analyze yung mismong fluid natin. Titignan natin through your bacterial culture, okay, para makita natin if there are presence of what? Of any disease causing microorganisms like your bacteria. Okay, what else? Of course, titignan natin kung ito ba ay gram-negative or gram-positive bacteria. We're going to assess also for the acid-fast bacillus stain. What else? Of course, titignan natin if there are presence of your red blood cells and your white blood cells. And of course, when it comes to our chemical studies, makikita natin dyan kung yung mismong fluid, there is actually a presence of what? Presence of your glucose. What are presence of your amylases? And of course, kung meron bang presence ng protein. Okay, and of course, hindi ko na-include dito, meron din tayong tinatawag na cytologic analysis. Okay, cytologic analysis. Wherein with this one, titignan natin if there is a presence of your malignant cells natin. And then lastly, we also have your pH level. Titignan natin if it is acidic or alkalinic. So these are the diagnostic tests, okay, that will determine kung kay patient if there is actually a pleural effusion. Okay, proceed tayo sa ating management nurses. Of course, number 1, since this is not, okay, this is rarely a primary disease process, no? Usually secondary lang talaga to any other diseases ang pleural effusion. Ang number 1, okay, or primary objective. Okay, primary objective natin for this treatment is to identify and treat underlying cause. Yun muna ang number 1 na gagawin natin. Okay, and then of course, next you have to prevent any reaccumulation of your fluid. Okay, if tawag dito para maiwasan natin na makompress yung mismong lungs natin, we have to make sure na natatanggal natin lahat ng fluids or abnormal accumulation of your fluids in your pleural space. And of course, we have to relieve your discomfort, your dyspnea, and even with your respiratory compromise. And we have to monitor as well your what? We have to monitor your pulse oximeter kasi that will determine if si patient is meron siyang poor gas exchange dahil nagkakaroon siya ng what? Hypoxemia or even hypoxia. Okay, what else? We have to place your patient in Fowler's position. Bakit? It's because, okay, that will promote lung expansion. Okay, di ba usually sabi nga natin kanina pag yung mga patients merong respiratory distress, ang number 1 talaga na position, okay, to promote your lung expansion is to place them in a Fowler's position. Okay, what else? We have to encourage them to do your coughing and deep breathing exercises. Same also with the other, dun sa ating positioning to promote your lung expansion. Okay, or para mas magkaroon siya ng mas maayos na tawag dito, paglabas ng kanyang secretions. Okay, and of course, we have to prepare our client for possible thoracentesis. Okay? So, dito tayo sa ating thoracentesis nurses. I know for sure, alam nyo na tong procedure na to. Okay? Ano ba yung tatlong purposes? Okay? Kung bakit si patient kailangan niyang mag-undergo ng thoracentesis. Number 1, that is just to remove your fluid natin. Para matanggal po natin yung mismong fluid na nag-accumulate in your pleural space. What else? To obtain a specimen. Okay? For us to obtain a specimen for possible analysis. Okay, what else? That is to relieve dyspnea and any respiratory compromise. Okay, yan po yung mga primary objectives natin kung bakit si patient kailangan niya mag-undergo ng thoracentesis kapag meron siyang pleural effusion. Okay? So, nurses, remember yung mismong insertion ng ating tubo here. When it comes, din ng ating large bore needle when it comes to your thoracentesis. Okay, usually kapag air ulit ang tatanggalin natin saan? Okay, sa ang intercostal space at this second to third intercostal space. How about pag fluid naman ang tatanggalin natin? It is in your 8 to 9 intercostal spaces. It's because sabi natin ang gagamitin natin dito is the principle of your gravity. Okay? So next naman tayo here, we have different pre-procedure nursing care. Of course, bago si patient mag-undergo ng thoracentesis, number 1, we have to secure their consent. Okay? And of course, you have to take your vital signs, okay, to determine or para makapag-obtain tayo ng baseline data. Aside from that, once si patient kailangan niya mag-undergo ng it's either chest x-ray or ultrasound prior to the procedure para ma-determine kung saan po yung mismong location ng ating pleural effusion. And of course, what will be our position here? Usually, ang recommended na position, okay, when you're going to insert your large bore needle, that should be in an upright position. Okay, kapag kaya ni patient na tumayo, that is to promote your what? That is to promote your lung expansion. Okay? And aside from that one, for us to not what? Okay, para ma-expose po natin yung mismong base ng lungs natin para hindi po natin ma-accidentally puncture yung ating lungs. Okay? That's why dapat naka-upright position yung patient natin. Naka-lean siya forward over a bedside table. Okay? And then next here, we have your next last pre-procedure nursing care. Of course, we have to instruct our patient to not cough. Okay, dapat hindi siya umubo. That's why, paano pag meron po siyang very productive cough si patient and ubo siya ng ubo, what are we going to do? Then you're going to administer your anti-tussives, okay, as prescribed by their physician. Of course, dapat hindi sila nag-breathe deeply or even move para hindi po ma-accidentally puncture yung kanyang lungs. That will eventually lead to your possible pneumothorax. Okay, so what are the different post-procedure nursing cares for patients who undergo your thoracentesis? Number 1, we have to monitor for respiratory status para makita natin pag nagkakaroon ng possible respiratory distress so that we could compare if there are any discrepancies dun sa kanyang respiratory status. Okay? What else? You have to position our patient to what? Okay? Pag leakage po, remember nurses, di ba? Pag sabi natin, pag leakage ang prevent natin, saan po natin ipoposition si patient? Okay? Sa kanyang unaffected side. How about kapag hemorrhage naman po ang prevent natin? Usually sa kanyang affected side. Kumbaga, luha naman po ang ating mnemonics here. Pag leakage ang prevent natin, saan natin siya ipoposition? Dapat sa kanyang unaffected side. How about kapag hemorrhage naman po sa kanyang affected side? Okay? And then next here, we have to apply pressure dressing to prevent any possible tawag dito bleeding or hemorrhage. And then next here, okay, we have here your tinatawag natin na assessing your site for bleeding and possible crepitus. Diba sabi natin kasi pag nagkaroon ng crepitus, that indicates na pwedeng na-perforate natin. Kasi nagkakaroon na yung mismong lungs, kasi nagkakaroon na ng mismong entry of your ear that will what? Possible magkaroon siya ng crackling sound or if you're going to palpate it, parang merong vibration. That is your tinatawag natin na crepitus. Okay, so that is your thoracentesis. Okay, mainly that is usually your ginagamit natin, no? as your as your primary management or treatment modalities kay patient na merong pleural effusion. Okay, pag ngayon, si patient meron siyang recurrence na pleural effusion, you have to prepare your patient for another treatment or another procedure. We have your pleurectomy and meron din tayong tinatawag na pleurodesis. Pag sinabi nating pleurectomy, from the word itself, pleurectomy, ectomy, nagkakaroon tayo ng tinatawag na surgical stripping. Okay, we're going to surgically strip yung mismong ating parietal pleura. Okay, nagkakaroon ng surgical stripping of your parietal pleura. Wherein this procedure, okay, it produces what? It produces your inflammatory reaction. Okay, pag in-strip mo, in-excise mo yung ating parietal pleura, pwede siyang mag-produce ng inflammatory reaction. And pag nagkaroon po ng inflammatory reaction, what will happen? That will promote what? That will promote adhesion formation. Okay, that will promote adhesion formation. Pag nagkaroon ng adhesion formation, okay, of course, between your two layers of your that will eventually lead to your possible healing. Okay? So, next naman tayo here, meron tayong tinatawag na pleurodesis. Ano naman si pleurodesis? Nagkakaroon po tayo ng instillation of what? Instillation of a sclerosing agent. Okay, sclerosing, ibig sabihin, tumitigas, di ba? Sclerosing substances or agent into your what? Into your pleural space via, okay, paano tayo makakapag-inject? Okay, paano tayo makakapag-instill ng sclerosing substance? It is through your thoracotomy tube. Okay, thoracotomy tube natin. Okay, wherein, pag nakapag-instill po tayo ng substance na ganito, that will what? That will create again another inflammatory response. Okay, nag-create mo siya ng inflammatory response since yung ating katawan madedetect niya yan na hindi po siya normally na nandun dapat yung substance na yan. And of course, that will lead to sclerosis of your tissues together. Okay, so ito po yung mismong management ng patient natin na merong reoccurrence of her or his pleural effusion. We have your pleurectomy and your pleurodesis.